You want to make sure you're aware of which medications you're taking while breastfeeding because they could impact your baby. So sometimes medications get passed through breast milk to the baby, and not all medications for depression are safe for babies. This can make postpartum depression treatment really tricky because medication is very important for getting well and staying well. The pros of medication for PPD are increased likelihood that your symptoms will decrease and that you will feel well again sooner and that you'll be better able to care for your baby. If you're on a medication that doesn't work for breastfeeding, it's not safe while you're breastfeeding, it can feel like you're kind of in this tension of needs. And it can be really difficult to figure out the best way forward. I highly suggest talking to a doctor that you really trust in order to figure out the best decision for you and for your baby. In general, SSRIs have been found to be safe while breastfeeding. Paroxetine and sertraline tend to be the safest while breastfeeding for PPD. Less is known about the safety of SNRIs. However, a lot of people respond well to SNRIs prior to pregnancy, and so they'll remain on them post-pregnancy. But because less is known and the research is inconclusive at this point, it's really important to consult with your doctor when you're making a decision in the postpartum period about staying on or trying an SNRI. The safety of the GABA-A modulator infusion for PPD while breastfeeding is still unknown. Research is still developing, but the research is looking promising in terms of it does seem that the GABA-A modulator infusion is safe while breastfeeding, especially because research has shown that 3 days after finishing an infusion, it's not even detectable in breast milk. The oral version of the GABA-A modulator, also research is developing. It does look promising. It does seem to indicate that it will be safe during breastfeeding, but it's a really important conversation to have with your doctor if you're deciding about whether or not to be on this medication while breastfeeding. I know it can be really hard in this time to consider not breastfeeding, but what is most important is that you are well so that your baby is well. And the best way forward sometimes is to pause breastfeeding, consider formula feeding for the safety of yourself and your baby.